Hello, my name is Choi. I'm honored to have give a talk about my research paper entitled Design and Implementation of Health Monitoring Platform. I begin with giving a brief introduction. First, recently COVID-19 has really led to an increase in mental health problems such as mental illness, depression, and suicide due to social isolation and social disconnection of the vulnerable. Accordingly, this research was conducted to build a platform capable of detecting depression and emergency situations through time series data measured on smartphone sensor information. In this research, we collect data and conduct the health and risk assessment and analysis to detect emergency situations through AI platform. The collected sensor data are largely divided into user information, sensor data, and diagnosis information. User information includes member account number, age, gender, name, region, occupation, income, and household member information. Sensor data includes the data date and time of data creation, distance traveled, number of steps, number of screen touches, data usage, and sleep time, which is time when mobile phone is not used. The sensor data is collected from a smartphone every 15 minutes. There are two diagnosis methods, PHQ-9 and ANX. PHQ-9 and ANX are not information collected by sensors. This is the result of a prior inspection of the subject to be monitored. In the previous slide, I mentioned two tools, which is Patient Health Questionnaire 9 and Generalized Anxiety Disorder 7. So I'm gonna explain those tools briefly. First, the PHQ-9 is a depression screening tool, which is standardized and developed by Spitzer et al. The depression screening tool consists of a total of 9 items, and each item is composed of 4-point scale ranging from 0 to 3 points. According to the total score, 4 or less is moderate, 5 to 9 or less is weak, 10 to 14 or less is moderate, 15 to 19 or less is severe, and 20 or more is dangerous. Generalized Anxiety Disorder 7 tool is a brief measure, provides a brief measure for accessing assessing generalized anxiety disorder. The GAD-7 score is calculated by assigning scores of 1, 0, 1, 2, and 3 to the response categories of not at all, severe days, more than half the days, and nearly every day, respectively, and adding together the scores for the 7 questions. Scores of 5, 10, and 15 are taken as the cutoff point for mild, moderate, and severe anxiety, respectively. When used as a screening tool, further evaluation is recommended when the score is 10 or greater. Because this is personal information of the research participants, it needs to be managed, protected very carefully from the viewpoint of research ethics. To this end, we conducted the research after obtaining IRB approval with control number 20221019.O.Session6. The IRB is an independent consensus-setting organization that deliberates on ethical and scientific aspects of human subject research for the rights and safety of subjects participating in clinical research. In accordance with the Bioethics and Safety Act, the IRB not only reviews research plans, but also investigates and supervises research progress and results, and conduct research ethics education for researchers and related persons. In this research, we make use of Spring Boot-based backend server technology to perform dynamic web development and data management exploiting model view data, shortly MVC design pattern, model view control design pattern. The Spring Boot is a Spring sub-project that avoids complicated XML configuration, enabling simpler environment configuration. Based on the Spring framework, our server architecture provides various core services or concepts such as inversion of control, shortly IOC, dependent injection, shortly DI, aspect-oriented programming, shortly AOP, and Java Object Persistence API, shortly JPA, and so on. Now, from this slide on, I'm gonna show a smartphone application storyboard developed in our research. In designing the information architecture, we focused on explicit categorizing of menus and avoiding excessive depths. Our application consists of about 20, more or less 20 pages, and various functions such as intro page, login page, measurement page, main page, ID and password, search page, information sharing page, and analysis result inquiry page are provided. There's a page where you this slide shows sign up pages in which there are joining member page. In this page we can see the ID, password, name, cell phone number, an address, an occupation, age, an email address. There's a page where you agree. There's also a page where you agree to the terms and conditions. This screen is a page that briefly provides the results measured by the sensor. And on the first page at the left side of the slide, we can see a monitoring screen. During the monitoring process, we can see the screen. They shows a status, the measuring states is going on. We can check the announcement or notification messages after the monitoring stage, which is provided from the system. So we can see that in the middle of the slide, the screen shows the result, measurement result. It is provided from the servo analysis program. This slide shows the analysis report and sharing information pages. If you want to check the health status of your parents or some other related persons at a distance, then you can use the information sharing service in our application. In detail, you can select Share My Information from the menu provided by our application and select the person to share information with in advance. This slide shows us dashboard pages and result pages. The dashboard continuously displays the data that this application measures every 15 minutes. We can continuously draw a graph using the data that this application measures every 15 minutes. The inspection results are provided as a bar graph and a line graph, as you can see in the left side of this slide. The data collected every 15 minutes is provided as a line graph. The psychological measurement page measurement is not measurement. The psychological checking or assessment page allows the subject to conveniently conduct a simple psychological test using a smartphone without the need to visit hospital. So you can easily check the anxiety level or depression, whether you are in a depression or not, using this application as shown in this screen. A method of measuring the amount of light passing through a finger and a method of measuring the amount of light reflected from a finger. We can, using this method, we can measure the SpO2 level of the patient or subject. This is a device that you can wear on your finger when you admitted to the hospital. In a hospital, you can monitor they will monitor you or patient using these devices, the SpO2 measurement device, because the SpO2 level is shows the status of a patient who is okay or not in the respiration function. So we developed a device for SpO2 monitoring. This device is looks like in this slide. We make use of MAX 30200 sensors in this board and a ARM-based embedded system. In this figure, we can see the board and JTAG debugger, which is colored by black. The black devices are connected to the PCB board in this figure. This is the JTAG device, JTAG debugging device. This device provides a firmware in-circuit emulation or line-by-line debugging to the embedded application firmware. This screen is a sub-side dashboard web page. This screen is not accessed by a general user, but by administrators or monitoring staff at welfare center in each region. This screen checks the overall status of users using this platform in real time. If an emergency situation occurs, it's counted and displayed as a number of patients at risk for mental health, as shown in the center of the screen. That brings the end of my presentation. Thank you very much.